Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
So I don't know how that's going to work. I mean, I've got a ton of plastic water bottles.
Yeah. Any other comments about that? If not, the other article, there were a number of articles that were of interest. There was this guy's advice for preventing heart disease, which is the leading cause of death in the United States. And number one, he says do both aerobic and resistance exercises. Uh, Aerobic exercise is well known that we need to do 150 minutes per week, but not too many people talk about the resistance exercises, which should be done at least 2 to 3 times a week. Then follow up. Second is follow a predominantly plant-based diet is the second recommendation. The third is to maintain a healthy weight. And then the fourth is to avoid prediabetes and the metabolic syndrome, which means you need to know what your blood sugar is, your triglycerides, your blood pressure, and the the lipoprotein levels, as well as your waist circumference. And avoiding that is one way of doing it. And then number five, keeping your blood pressure in the range of 120/80 or lower is thought to be ideal. 130 had been the target before, but they've made it 120/80. And they recommend what we've said quite some time, that everyone should have a sphygmomanometer at home and to be able to know what your blood pressure is and to know uh, if your blood pressure needs to be monitored and if you need to take treatment for your blood pressure. And then they're suggesting that there are some genetic tests that can help you know whether you have a high risk for DNA. Actually, a lot of that can be determined by how long your mother and father live and whether they have heart disease or not. And then they talk about the doing the uh, CT scan to measure your calcium and your calcium score. You talked about that before, but that's becoming more and more commonly done to identify the risk. Some people have zero, some people have results in the hundreds, but the healthiest score, of course, is 0 to 5. And then get your uh, blood limit, so you should know what your hemoglobin A1C is, and you should know what your lipids are, your LDL and your HDL. Uh, the HDL should be normal or high, and the LDL should be low, uh, in the vicinity of 100. And then you talk about the not smoking, of course, and then they talk about exposure to microplastics and forever chemicals, which we talked about 2 weeks ago. And those are really becoming more and more evident that that's causing a lot of inflammatory diseases that we have in this country. And then, of course, not smoking, and then, of course, 7 to 9 hours of sleep a night. Those are the 10 uh, recommendations this expert made for preventing heart disease, which is the number one killer in the United States. Any comments on those articles that I've just shared with you? Okay, if there's no comments, we can go to the articles that John and I have chosen. This is actually not a surprise, but I guess the fact that this is all related to obesity is what is more surprising. The fact that the marked increase in cancer is related to the marked increase in obesity. And so it's important for us to recognize that obesity and cancer are directly related. And what this study does points to that the states that have the highest rates and lowest rates, but that uh, the common factor is obesity. This article says 40% of Americans have obesity. Some articles say 50%, but anyway, whether it's 40 or 50%. The point is that the more obese we've become, the more likely we are to have cancer. And it has a list of 13 types of cancer that seem to be associated with the being overweight. Uh, Kind of a surprise to me. I didn't realize that cancer and obesity were so alarmingly related. I know they were related, but not along as this article shows.
Creating my time, my skills, my labor. This goes on throughout the year where I'm responsible to keep records of
Betty,
all.
you want to mute Betty?
Okay, this one is
Sorry.
Okay, any comments or questions about the problem with obesity, except that it's a negative factor. Closer you are to normal weight, the better off you are. Darryl?
Hey, I got a comment, and it has to do with organic versus conventional food. And the main difference is that conventional food uses pesticides. Organic food does not. And looking at an AI overview that says, based on current research, there's growing evidence suggesting a link between exposure to certain pesticides and an increased risk of obesity and related metabolic disorders. So that's, we talk about artificial sugars promote obesity, but they're not alone. It's probably the pesticides and conventional foods as well.
Thank you for sharing that, Darryl. Any other comment? If not, shows that in many ways we are glorifying people who are overweight is not exactly the right thing to do. But that's what we're doing these days. Uh, this article points out that by doing more screenings, we have more early stage colon cancers, which can be treated. And this is important. Of course, we've removed the age limit from 50 to 45. And we still have, I just recall reading a young man who died in his 30s who had colon cancer. So that even though the age is 45, there's still younger ages that have colon cancer. So if you have colon cancer in the family, it's probably a good idea to get a screening of the colon with a colonoscopy. Any comments about this? Because I think it's one of the great advances in the 20th century has been the appreciation of the fact that colonoscopy and removal of precancerous lesions can reduce the possibility of you getting cancer of the colon, which is a lethal disease. And if you're above 45 and haven't had one, you need to have one. And usually if they do a colonoscopy, they find you have no polyps, then you're good for 10 years. And if you have a polyp, they want you to come back within 3 to 5 years. Any comments? They talk about many of the things that Kennedy is doing. uh, well, some say he means well. So,
I have a question.
yes,
What causes polyps to appear in your colon?
we don't know. We don't know why polyps appear. We just know that their appearance is as a precancerous lesion, but we don't know exactly what causes polyps to occur. And why some people have and some people don't. Some people have diverticulitis and some people don't.
Thank you.
Yeah. Okay, let's go to the next article then if there's no more questions. And COVID is still with us, and there's evidence that this summer COVID is going to be a problem. Not as much of a problem as it has been in the past, but a problem nonetheless. And people are questioning Kennedy's elimination of indications for vaccine for some categories. And there's a lawsuit about it, but a lot of things that Kennedy's going to be doing that are going to be brought to question. I'm sure he means well, but
Dr. Callender, his reluctance to recommend the shots doesn't mean that people are not going to get the shots, right?
no, it means, and he only said that for pregnant people, and I forgot the other condition. Oh yeah, for kids, that's right. Pregnant women and healthy kids don't need to have it. And he didn't say that you cannot get the vaccine if you want it, but he just said it's not recommended, which is not good because that's unwise. So, and that's what they're suing him about. So, Dr. Perez?
I had my worst bout. I think I shared it with you of COVID the third time, and this one was the worst. And I know you keep saying he means well, but the impact of his decision is that it's no longer treatment for it is no longer covered by insurance. So my copay for Paxlovid went from $0 to $700.
Wow.
And the issue, especially as it relates to vaccinating pregnant women, with the maternal mortality associated with Black women, that is a very negative and detrimental policy. And the fact that he has also stopped so many longitudinal research studies that we don't have anybody who's willing to follow populations. So it is his opinion that it's not supported by fact because he's the secretary turns into policy that can take years, if ever, to change. We have children going to school who are not going to be immunized. mRNA, he has halted the study on vaccinations that we HIV people have been pushing for decades. It's serious.
Well, yeah, it's serious, but hey, we put Trump in power, so we have to deal with the consequences. Uh, yep, yep. You have a rogue president and a rogue secretary of health.
Darryl has his hand up, Doc.
Yes, Darryl.
Yeah, there's other ways that health costs are going up too. With the tariffs, I've been ordering it from a Canadian pharmacy because it's $200 on an order versus 800 from a United States pharmaceutical company. And with the tariffs, that's increased the price by $80 on each order.
Mm, wow. We get hit in a lot of different ways, huh? Wow. Hmm. Any other comments about new administration? Okay, this article talks about the new COVID variant spreading in the United States, which was zero before, and now it's up to 14%. But the COVID vaccine does cover the variant, apparently. So it doesn't say that it's any more virulent than anything else, but it's just saying that it's a new variant. Uh, However, it as Dr. Perez pointed out, the cost of the vaccine is going to be, and then the treatment. Uh, as she mentioned, it's one thing for the vaccine, which is preventative, is another thing for the treatment of COVID, which is another story. John Buchanan?
Yeah, this is for Dr. Perez. Did your analysis of your COVID tell you which version you had?
No. And I shudder to think of what finding that out would have cost.
Yeah. Yeah. Okay. Well, of course, nowadays the CDC has been silent on most things. So uh, what they have to say these days is remains to be seen. This article just talks about the states that have the most cases, uh, and shows that during the summer the COVID cases are increasing, as we talked about before. But here are the states that right here that have the higher percentage of COVID tests. You can see California, Washington, Oregon, and I guess Arkansas and Louisiana.
Mostly red states. Sorry about
Yeah,
that.
yeah. Okay, let's go to the next one. It's interesting that this article says that it's rising as they plan to restrict booster vaccines, uh, which is antithetical to what should happen. Uh, we need vaccines more now than ever before, and they're doing just the opposite, as Dr. Perez has already indicated, just as well as eliminating studies on the mRNA. which is the newest technology for vaccines. So in many ways, we're going backwards rather than forwards. And everybody seems to know this except the new administration. And what this does, of course, is decrease the number of people who actually get vaccinated. But we knew this when we put Kennedy in the position of Secretary of Health, but we did that anyway. So it's not like we didn't know any better. We knew better. But unfortunately, as Dr. Perez has mentioned, politics was more important than anything else. So they confirmed him. And now we are suffering. And the question is, can you still get a COVID vaccine? Yes, you can still get a vaccine. It's just that any new or vaccines that could be developed will not occur. So the ones that have already been done are done. So the vaccines are still there, but won't be any new ones.
I mean, that is such an important statement. There won't be any new ones. That is what we do with vaccines. We know that before 2050, that more people will die from infectious diseases than cancer, and we're going in the wrong direction. This
Yeah.
is crazy.
Well,
It's so crazy. It's like we're walking off a cliff.
what would you expect from Trump and his administration? That's what you would expect.
But
Joyce?
like Texas did, we cannot be. It's like we are overwhelmed by our inability to do something. And we've talked about mental health, and we've talked about mental health impact on our overall health. This is a bad, this is such a bad state of affairs. I have to look at my grandson to excite me, to make me joyful, because this is horrible.
Many agree. Joyce, you had your hand up?
Yeah, I think I already know the answer to the question, but I just want your confirmation. This year's vaccine is based on last year's standards.
Yes, and yeah, you're talking about which vaccines? You're talking about
The
flu?
COVID.
COVID, it's but yeah, it's based on uh, uh, when you say based on, what do you mean? This is
The
mRNA.
formula that they use to for the vaccine is based on last year's formula that they use when they
Yes,
do.
yes,
Okay,
yes. It's an mRNA vaccine. Yeah. The problem is
thank
there
you.
won't be any new ones, but yes, the ones that are already done are done. But as far as going forward, that's not going to happen in the United States. It'll happen in the rest of the world, and we may follow them, but we'll be backwards. And this is the lawsuit that six medical societies have sued to reverse his decision. I don't know how long that's going to take to be dealt with, but
I just wanted confirmation that I was thinking correctly. Thank you.
yeah, you are speaking correctly. Yeah. Betty Blaylock?
Yes. Good morning, everyone. Um, so really what you're saying is the vaccine that we'll be getting this year, if we decide to get it, is last year's vaccine, or they have created
No,
a
no, it's the same vaccine. It's just that it was done last year. That's all, before Kennedy. That's all.
oh, but it's different from what we got last year.
Yes.
Okay. Okay. Thank you.
Can I ask one thing? You said if we decide to get it, what would impede you?
Kennedy.
Yeah, but don't listen to him.
No,
But
That's the only thing that would impede anybody. Is
yeah, I just threw that in, but I definitely will get it if it's available.
and
But
it's so important for us to tell our people to get it.
yeah, oh,
We have got we have got to, since it's not coming from the secretary, we're the ones that have to speak truth to our people. We've got kids that are going back to school, and I'm a pediatrician. If you I've never seen a had a day with children when somebody didn't have a runny nose. I mean, they're Nedixes for all types of infections, and now we're sending it's like sending him into the battlefield with no protection.
yes, and this is an it. Yeah. Any other comments about that before we go to the next article? Because this is where Kennedy has asked for a retraction of a study that we discussed 2 weeks ago, in which the study found that aluminum was not responsible for increasing health risks for children. And this is something that Kennedy had fostered for some time, but the studies remain the same. And they demonstrate that there's no problem from aluminum in vaccines. And he didn't like that. But I mean, uh, his background doesn't give him a reason to make you believe that he has any credence to his argument. And so we discussed that article 2 weeks ago. It's just the opposite, because he was suggesting that aluminum caused autism. And this study says no, it does not. Looking at thousands of patients. It's interesting that in addition to them taking us backwards, they also are trying to prevent us from going forward in any any way. They just want us to. It's back to the days when Trump was talking about these different treatments for COVID, none of which worked. Well, here we are again.
Dr. Callender and everybody, good morning. It's sort of like, it reminds me of the haters, the anti-science people who don't believe in science. So they put down all the smart people, and hate on them because they're dumb, you know. They want to pump themselves up, so they put down the smart people and make it like they're pariahs, the smart people. We actually, kids do that too. I remember at Spingarn, believe it or not, we had to have separate assemblies for the honor society and the very successful kids, because some of the other kids who were not honor society who were not really smart were hating on those people, and the smart people wouldn't even come up to the stage to get their awards because people were hating on them. I remember Obama used to say, "Brush the haters off," right? Brush the haters off.
Mm.
This reminds me of that, you know.
Well, it should, because what you're seeing with Trump is the situation where the group that wanted to be on top wasn't happy with their status. So they are trying to change uh, it so that their status is the top and everybody else is below. And that's what this administration is all about. Uh, uh, Making America great again, which is a key word for saying making America. Uh,
White.
yeah, it's all about racism. Yeah. This is an article about summer sniffles that Dr. Perez was talking about. Yeah. And the three key illnesses, COVID, flu, and RSV, uh, right now is low, but it's going to increase as we go towards the winter. It'll be interesting to see what happens this winter. Dr. Perez?
Again, and with the atrocity of bringing in the National Guard into DC, breaking up homeless, unsheltered housing, or, all of this pointed. I mean, it is so ridiculous. At a time, we know that we're going into this time as the summer ends and we go into the fall. It's ridiculous. What are we doing?
What do you mean, what are we doing? You put in place a dictator and are now wondering why the dictator is acting like a dictator? What, what else would we have expected? He never posed as anything other than a dictatorial type. Never has he posed as anything other than that. Yet we put him in power with an overwhelming majority. So we have to deal with it. Uh, Moving on, this about the influenza vaccine debunked for primary care patients. For those who believe some of the myths that the administration has brought up, this addresses a lot of the issues to point out that they're not credible. You read about the guy who shot up the CDC because he felt he had complications from the COVID vaccine. And so these anti-vaccine people are in that same position. And these myths are common. And this article looks at many of them and points out that their scientific basis is lacking. The egg allergy was one of them, and there are others. Any comments about the, I think most of us recognize that vaccines have been one of the most important developments in the last 100 years. And the COVID vaccine was a marvelous example of it. No comments. The next article is talking about a woman who loved cheeses, and after stopping her cheese obsession, she lost 60 pounds, and you see the weight between the two pictures. And uh, after she was identified with type 2 diabetes, she stopped eating all the cheeses, and she now is someone who teaches wellness, and very happy with her situation in which she's lost all the weight.
You know, I don't like this article.
You don't like this article?
No, because I love cheese.
That's
I put cheese in everything.
all she ate was cheese. Wow.
Whoa.
Everything in moderation. She went to the other extreme. Suggesting it's all in what we eat, huh?
Yeah. Here we go.
This is an interesting article because there are many reasons why you may be gaining weight. And sometimes it's not what you think or what your doctor may think. As you run down this article, you see the many reasons why people can gain weight even though they haven't changed their diet. Hypothyroidism, of course, is one of the common ways. Polycystic ovary syndrome, depression, anxiety, insomnia, intestinal overgrowth, and then, of course, menopause, and then also medication like steroids and other serotonins, Cushing disease, and then finally dehydration. But they don't mention ovarian cancer. Yeah, number 10, ovarian cancer. As Janice has told us about her sister who uh, was gaining weight in her stomach and turned out to have ovarian cancer. Diabetes. Yeah. So this is interesting articles for those who gain weight and aren't sure why. So you can be evaluated and all of those causes addressed. Interesting, as we age, we lose muscle and increase fat. So you have to really work at exercise and different that to correct that imbalance. Talk about the intermittent fasting again. Well, as you age, that might be motivation enough for people to eat less and exercise more. But for some, it's not. Any comments about this oh, very interesting article? No hands? Okay. Let's go to the next article then. This is an article, obstructive sleep apnea, that we've talked about before. And we now have a new medication for obstructive sleep apnea, in addition to CPAP and also Inspire, which is a new operation, a relatively new operation that they do that makes CPAP unnecessary, but also addresses the obstructive sleep apnea. CPAP is considered a treatment of choice, but there are other treatments. John Buchanan?
Yeah, I've been on CPAP now for probably 4 years, maybe 4 or 5 years, and I've always wondered uh, about the other health issues that come along with it, uh, including bacteria, mold, things like that, viruses that could come through the system. Even if you are using distilled water uh, to humidify the air, but I haven't really seen any studies about it.
I haven't either, now that you mentioned it, because it's the gold standard for obstructive sleep apnea. I haven't seen studies that address the issue that you brought up, because it has been the gold standard for some time. Inspire is still one of the treatments, and this new medication, GLP-1 drug, is I haven't seen any studies that compare the two, so that remains to be seen. I'm sure we'll see some soon. But the CPAP still remains the gold standard for treatment of obstructive sleep apnea. They have an interesting commercial where you see this gentleman who's got Inspire, who doesn't have that CPAP, and uh, it's a good advertisement for Inspire, which is, but everybody doesn't qualify for Inspire. So, because it requires a surgical operation. Yeah. Now, this is an article that talks about the importance of weight training, and that aerobic exercise is important, but so is uh, weight, lifting weights, and that's the strength training is 2 to 3 times a week is something that we tend to underestimate its importance. But 2 to 3 times a week of pumping iron is thought to be a missing link for those who don't do it. So aerobic exercise alone is not enough. The addition of resistance training makes it complete. Dr. Perez?
This and maybe an article 2 or 3 before. Um, and I guess because of uh, how in the wrong direction we are going with the American policies around health, that we as a group of disciples have to kind of change, whether it's the tipping, the tipping effect, that it's time for us now to have a significant societal change, And I guess I feel the Lord telling me it starts with you. Um, that I know there's something that the National Medical Association does, and we've been doing it for over a decade now, and it's called Walk a Mile with a Child. And like we are learning here, um, I think it was John or brother Darryl that was moving a weight um, during the time that we were sitting here for our group, that we have to do little changes within our family and our community that make it acceptable for other people to do it as well. Like instead of me meeting a friend for tea, I need to meet a friend for a walk. If there is a small wait near where the phone is or where I tend to watch TV or something, then I have put a change in my own life, but then it becomes um, something that someone else will do. Our community, the Black community, has to have a societal change to get us to better health. Walk a mile with a child. Our young people can't have a curfew. We need to walk with them. We need to talk with them. We need to uh, change some things. and this tells me that my little weight, when I'm sitting down next week, God willing, I will have my weight, and I will increase my muscle mass, and I expect that to be um uh a modeling that I will do for the next generation.
Well, it's interesting. It starts with 1 pound weights, 5 pound weights, 10 pound weights, and so on. Goes up uh, as we've talked in this group. Darryl has mentioned many times the importance of resistance training. So this reemphasizes how important it is. And then, of course, the other things that you see here, getting enough sleep. Sometimes we don't get enough sleep in addition. You see, getting enough sleep is there twice. So uh, these are important messages to go on. Darryl?
Yeah, it's kind of like a 2 for 1. If you spend 2 to 3 times, well, preferably I'd say 3 to 4 times a week lifting weights, and you get a good workout, like you work up a little sweat, it'll help you sleep. And so that'll help your heart, and the sleep will help your heart. It's a good 2 for 1.
Thank you for your role modeling. Yes. Yeah. You've done a great job in terms of educating us. So keep it up and modeling for us. Uh, okay. Any other comments? What weight is that you have, Darryl? What pound weight is you lifting?
That was a 15.
15. Okay. Mark.
Yeah, so I'm following in the footsteps of my Uncle Darryl, and actually came from the gym earlier this morning myself. And I noticed, but my larger comment is that I know it starts in the mind. Most of us are guilty of saying the phrase, "I don't feel like it. I don't feel like it." Um, and I I've noticed that, when we go along with that feeling, that thought, we don't get anything accomplished. And so I've just taken the kind of a short spiritual journey with that. Like, where does that come from? It starts in the mind. Like, I don't feel like it. I don't feel like lifting weights. I don't feel like exercising. And getting to the bottom line, it's not to get terribly deep, but it's one of the seven deadly sins of sloth. Um, of not pushing yourself to do what's necessary. Just kind of relaxing into what your feelings are. And but then again, that's why it's a deadly sin, because when you lean into that feeling, it gets nothing accomplished, and it contributes to poor health. So it kind of takes this counterintuitive approach to go to do the opposite of what you feel in order to get to achieve maximum results. Yeah, I don't feel like it, therefore I need to do it anyway, because I don't want to I don't want to end up in a worse situation. So
Thank you for sharing, Mark. Darryl, you had another comment?
Yeah, we're also creatures of habit. So if you make it a habit that you put it in your routine at a certain time every day, or for your 3 or 4 days a week that you exercise, then making it a habit makes it easier, because then you don't have to go through the mental gymnastics. When the habit kicks in, you'll miss it. You'll want to gravitate and go do it because it's time to do it. You'll feel good about it. If it happens that you miss it, you miss your workout routine, you'll be eager to do it the next slot. You just don't want to keep missing it so long that it becomes the other habit, the habit of missing all your workouts.
Thank you. There's another hand up.
Yes, so I definitely relate to that. The negativity that can come from, I think it's fear. Um, I, I I travel like 20 minutes to the pool 3 times a week, and sometimes I think, why am I driving all the way across town? Even when I'm walking up to the pool, I'm thinking about turning around and going back home. The upshot is that once I'm finished, there's no better feeling than having accomplished, swimming a mile, 1.2 miles, 41 laps, uh,
Mm,
which is my 3 times a week routine. Oh yeah,
wow.
this week I got down to a 30-pound weight loss because in COVID I weighed 205 and I got down to 174.
Wonderful, wonderful, wonderful. What a role model. So many role models we have. Darryl and John Buchanan. Wow. Hmm. People like that, we don't need any more models. Just follow them. Okay. All right, the next article. This is very interesting because we have discussion about sugar sweeteners all the time. And this talks about stevia and monk fruit. They get a green light, but the rest of the sweet softeners don't are not recommended anyway. And then we've had discussions about this all the time. And I was interested. There's also an article that says the stevia uh, prevents pancreas cancer. But anyway, it's this is an article that we've also talked about the fact that caffeine is good for you, and that the sweeteners take away some of the greatness of the coffee, of the caffeine. But anyway, this is a very good article that looks at this sweeteners and puts into perspective the different sweeteners and identifies those that uh, desirable and those that aren't. Uh, any comments on this? Because I don't know how many of you have used stevia. I have not. I don't. But the diabetics uh, use sweet softeners. At least some diabetics do, some don't, because they just avoid sugar. Janice?
Yes, you've made me a believer. We've had this subject, we've discussed it several times, sugar versus the artificial sweeteners. And I was the yellow packet person, loved it. But now I found that I've gone back to sugar. I use less sugar. Um, I don't need as much. I don't know what happened to my taste buds, but I think it's a good thing. I'm not using the artificial sweeteners and I am using sugar. So, again, one of the good things, many of the good things that have come out of our discussions here.
Anybody use stevia? Dr. Perez?
No, I don't use stevia, but in terms of the sugars, I hope you're using raw sugar and not white processed sugar.
I'm processed. I haven't tried the raw sugar, but maybe I will.
Okay.
Mhm.
Um, I'd like some of the, you know, those that are knowledgeable about it, because I noticed in the bodega and in the local neighborhood stores, you usually can only find white processed sugar or a new thing that Domino is coming out with that's golden. So asking for it can help. There is a slight difference in taste.
Well,
Um,
yeah. It's interesting. In the old days, they used to have brown sugar, but
right.
you don't see it anymore. Somebody else had their hand. Oh, Darryl. Yeah.
Yeah, I say embrace the bitter. You know, that's a good step going from artificial sweeteners to real sugars, but not as much. But you're better off just embracing the bitter. And what I mean by that is that coffee has a good taste with no sugar, but it's bitter. You can learn to appreciate bitter. And to really appreciate it, try doing a 3 week fast of no sugars, no artificial sugars. Your taste buds will change. You'll come off of that 3 weeks and you won't like the taste of sweeteners, of sugars. It'll be too sweet. You know, you can still eat fruits, but your taste buds will change if you give yourself 3 weeks to embrace the bitter.
I agree. That's my goal. I mean, to be on artificial sweeteners and getting away from it, going back to regular sugar, definitely I use less. So I'll try to reduce it even more.
Well, I'm trying to go cold turkey.
Mhm.
Go 3 weeks with no sugars. Real
I'll
or
try
real or
it.
fake.
Mhm. I'll try.
Okay. Any other comments? If not, this is the article we were talking about that stevia uh, knocks out pancreatic cancer cells, which is unexpected consequence of the only one of the two recommended sugar substitutes. Okay, let's go to the next article. This is an interesting article that, as we often try to find out why people have Parkinson's disease, and they did find this virus, which is a harmless virus, but yet it was not found in any other brain tissue other than those who had Parkinson's. Whether this is something that down the road will result in treatment for Parkinson's remains to be seen. But anyway, it's a first time that anybody's found something in Parkinson's brains they did not find in anybody else. So time will tell whether this will be the beginning of finding a treatment for Parkinson's disease, for which there are treatment for symptoms, but really no treatment for the disease itself. Any of you have relatives with Parkinson's disease? Because if you didn't, you wouldn't know the difference. Dr. Perez?
My my oldest friend has Parkinson's, and it's hard,
Yeah.
and most of the treatment for the symptoms have such severe side effects that you know my oldest friend now doesn't talk, um, finds it hard to sit up, and it's it it requires a real belief in grace, because it was wonderful seeing that she recognized me, but I felt that she couldn't share with me, nor I with her, the way we've done for, I can't even say, for over 60 years.
Mm.
Um, you know.
Yeah. Thank you for sharing. Thank you for sharing. Yeah. Okay. Whether this will be the beginning of finding a treatment for Parkinson's, we don't know, but we're searching desperately for hope since we don't have a treatment for it yet. Okay, let's go to the next article then. This is an article that is a wake-up call for your children and your grandchildren, great-grandchildren. Appreciate the fact that uh, e-cigarettes and those other uh, vaping uh, solution that people use to inhale damage the lungs. And so they need to stop smoking. They need to stop vaping, because this article identifies a number of cases in which e-cigarettes and the vaping have caused pulmonary damage and sometimes death as a consequence of pulmonary destruction. So no, e-cigarettes are not recommended, and they are destructive to the lungs, as we already know about nicotine in cigarettes. Any comments? Have you noticed among your children or grandchildren or great-grandchildren believing that e-cigarettes are okay? They aren't.
I had a side comment, Doc, about hookah. Sometimes when I play, they have hookah bars where people smoke out of like a water pipe, but I don't know what that is. Anybody know? Is that the same as vaping?
Yeah, I think it is. Yeah.
I think it's a little different. It's more like smoke from a pipe, and it's tobacco. It's not a propellant like with vaping.
Well,
So it's similar to the way marijuana or hash was used for smoking, but they're only supposed to be using tobacco.
Well, tobacco's no good anyway. Mark?
Yeah, no, I concur with the doctor. As a occasional user of hookah, um, it is more tobacco oriented. Um, and the process is a little bit different than vaping, but at the end of the day, still harmful.
Darryl?
Yeah, AI says hookah and vaping are not the same. Like we said, hookah usually involves burning tobacco with charcoal, but vaping uses electronic devices to heat a liquid, an e-liquid, into a vapor, which is then inhaled.
Well, thank you for sharing. Yeah. So make sure that your kids and grandkids and great grandkids don't think that it's harmless. Yeah. So, and these cases that they discuss are enough for you to be wary of your kids being involved with this. It's a good wake-up call for that. Uh, let's go to the next article. This is it's a very interesting article because I encountered a couple of during the last couple of weeks a family who used smartwatches, and as a matter of fact, they were feeling pretty well about themselves, and in the middle of the night, the smartwatch said, "Your heart rate is abnormal. You need to go to the emergency room."
Mm.
So they did that, and they found out they had auricular fibrillation, and they had to be treated. And so the smartwatch can be helpful. And if the smartwatch says that you got a problem, you need to go to the emergency room and get it dealt with. But the thing that I wondered about is, or recognized, is only people who have some degree of wealth have these smartwatches, and people who aren't well off don't tend not to have these smartwatches, but they can be of merit. Uh, how many of you actually have smartwatches that monitor your heart rate all the time? Any of you?
I have a I have a smartwatch, but if something were to happen to me while I was sleeping, I take my watch off at night, just like just like I did with a regular watch. So I wouldn't know anything about it.
Well, you should
Yeah,
keep it on.
actually, I have the same. Yeah, I have the same thing. I do have a smartwatch. I'm fine during the day, but I take it off at night. So I need to wear it at night now. I don't know.
Yes, yes. As a matter of fact, this happened in both of these instances at night.
Mhm.
And then when they looked at the smartwatch, they wondered, "I'm feeling fine. Why should I go to the emergency room?" But when they went to the emergency room, they found out the watch was right, and they had abnormal heart rhythm, which needed to be treated.
Yeah, I've got the ECG app on my smartwatch, and it was very accurate in triggering the AFib episodes that I had. But like everybody says, well, I've got an older watch where the battery doesn't last through the night. So whether it's comfortable or not, I got to take it off to charge it at night.
Okay, Dr. Perez?
I when I'm kind of coming down and getting ready to go to bed, that's when I charge my watch. because many of the watches will also cycle your sleep. And it was important for me to know when, in deep sleep, my hormones were repairing my body. And so I found out, even though I haven't had to run to the emergency room because of my watch will detect a fall. My watch can be set to call if I don't respond, my emergency people. And to say the issue of wealth, if we really care about people and we're about equity, the people who need it the most, it should be part of their insurance.
Should be and is two different things.
But we're going to the polls. We're not going to allow this to occur to us again.
Well, it's occurring, and to me, it's an issue that the rich have and the poor don't have, and they wouldn't know the difference because if you get a arrhythmia, you might die, and nobody would even know. And the commonest cause of people dying from heart conditions is from arrhythmias. So.
And so, even though I didn't, when I wind down, I charge my watch so I can sleep with my watch, and then charge it up, at another time early in the morning.
Any other comments about the smartwatch and who has it and who doesn't have it? And Betty, better up?
Yes. The everybody, even your children, have phones. So the phones are much more expensive than the smartwatch. So if you can afford to give your child a phone, you should be able to get a smartwatch.
But you say should be, but we don't.
Yeah, but this is what I'm saying. They will buy the phone. So
Yeah,
and
but we did, but I think that the issue is you got to be aware of it. You got to have information about it, and if you don't know about it, you can't do it. And I think that's one of the educational pieces that it's really shared.
well, uh, truth telling, I never even considered a smartwatch, but it came as a once I traded a phone in, it had the smartwatch at a reduced price. So I just got it. I wasn't even thinking about what it did or whatever. So I
Yeah.
think the companies that do the phones are the ones that have the smartwatches. So there's always deals and stuff that you can get.
Well, but then it's important for us to realize that that's not something that the community is necessarily aware of. And the education and empowerment of the community relative to this is an important part of equity that really is missing.
Yeah, they key in on the
And
phone.
if the wealthy can have it and they can get treatment because of it, and we don't have it and we just drop dead because of the lack of it, that's a concern.
Until we have the you.
Dr. Perez?
And again, a lot of this technology has been on our dime. The taxes that we pay that have gone into technology people are getting rich off of it. And there's not equity for the masses. And I haven't even begun to talk about genetically, but it's not as if anybody is really giving us anything.
I'm lost. What has genetics got to do with it?
Well, I'm saying that, decoding the human genome, a lot of federal money went into that. And
Yeah.
I assume that as we go into personalized medicine, there there are a lot of people, industry that owns genes. So I'm saying we're talking about technology now with AI and and a field that has blossomed because of federal dollars that went into building that knowledge.
Yeah, but what I'm pointing out to you is that here you got a situation where people who are well off have a technology that people who are not well off don't have. And the people who are well off are living, and the people who are not well off are dying. And somehow this is a mismatch that we need to do something about. I just think that we need to have the community educated and empowered about the smart watches as well as anything else.
And I'm agreeing with you. And I'm taking it to the next level to say the development of that technology was shared by everybody in taxes, but the benefit of it was not.
Yeah, okay, we agree on that. And that's the point I was making, that's an issue that maybe is not even looked at as a significant inequity issue, but is one that is glaring when you encounter people whose lives have been saved because of their smartwatches and recognize that majority of people may not even recognize that that technology can be life-saving. Okay, well, I just thought that this article was interesting because of what it does not say. Right. Okay, let's go to the next article unless there's any additional comment. This is Betty Black. You had a comment, and Lucy again. You guys want to say something else?
I hit it by mistake.
I lowered my hand.
Oh, okay. Okay, well, this is an article for this the first long-term breakthrough that I've seen that shows memory preservation over 4 years in early Alzheimer's. And this is a study that has involved uh, close to 2,000 patients with about 890 patients in each arm, which uh, demonstrated that there was a an improvement of memory compared to those who didn't have this technology. And that's something because that's not really been evident before. This is a treatment that consists of IV infusion, but this may be the beginning of something that may result in a treatment that may be of benefit to people who have early Alzheimer's. And we really haven't had any successful treatment for that up to this point. So I thought it was good to share that we're moving in a direction that may get us to the point where we have a reason to make an early diagnosis of Alzheimer's and start treating it. So this is one of the first articles I've seen that has had a prospective study that demonstrates that it's of value over time. So that's good to see they were making some progress. Any comments on this first step? Well, anyway, I think it's good to see that we're getting to the point where there's a benefit of making an early diagnosis of Alzheimer's and initiating treatment. Jochebed?
Yes, sir. I tell you, it, 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 these these articles are really better for me than watching the news on TV or listening on radio. Because what it is doing to me is that Kennedy wants to downgrade research and take away money for research, and in these articles tell you that research is very important in finding things that I mean, the smart watch, telephones, the CPAP machines, and as Inspire and all of that stuff. I mean, that didn't just happen overnight. That took some time, and I'm just so disgusted that our government seems to be turning, putting up a finger, that middle finger, to research and science and discovery and prevention. I'm disgusted. I couldn't even celebrate Fourth of July because I just feel there is no independence. And that's all. I'm just screwy today.
Well, it's interesting you expressed something that many of us are feeling. So I'm glad you shared. Yeah. Dr. Perez?
And so am I. So grateful that you shared because this is what's going to move the needle. We are not hopeless, and we can express our frustration because I don't think everybody appreciates how bad this is and how much worse it can get. There are so many people who are disconnected and they're not sharing and they sit alone. And so many of our young people are that way. And to be able to hear that they're not alone in their feelings and the heaviness, that sharing, getting it out is so important. And I'm so glad that you shared, and I'm so glad that we're moving forward. And I'm glad that this transplant support group is here to do that, to support and help us move forward.
Thank you for your comments. And I think that's a reminder that we have a job to do, that that this group is here for a reason, and that this may be just the beginning of something very, very important. Next article. This is an unbelievable article that talked about the damages of social media. And at my transplant meeting, one of the things that was emphasized was the miseducation of American people. And the fact that social media has taken us to a place where we don't want to go. And there's so much misinformation that the truth is the lie and the lie is the truth. And so this article just talks about how people have used the social media to kill people, and how we have to be wary of social media and to protect our children and our children's children from it. This is a wake-up call to us. This shows us how much harm can be caused by misinformation. You know, one of the things that we've done with our MOTAP group that people underestimate and underappreciate is that all we've done that has been successful is to go into the community, educate them, and empower them to become part of the solution to the problem. And what we're doing is educating and empowering them, not miseducating or unempowering them. And that's just what is missing in this day and age. We've got social media, which is uh, spreading misinformation all over the place. And this is contaminating our children and our young adults and even older adults. And so we need to wage war against this miseducation and misinformation that makes the lie the truth and the truth the lie. But anyway, this is what this article brings to mind. Darryl?
I'm laughing because whenever I see people sitting anywhere, it could be a doctor's office, a restaurant, any business where people are sitting waiting to get served or whatever, uh, I would say that it's probably 9 out of 10 people that are looking at their cell phone.
Yeah.
And it's okay if you're going to check an email or your text messages and see if anybody wants you, but that doesn't take very long. But people are looking at their cell phone like many minutes at a time, which means they're on social media. So with this prevalence of cell phone usage for social media, where everybody's doing it, if I try to keep my cell phone in my pocket, and so I'm swimming up against the stream because everybody else is on their cell phone, which makes me think that maybe we say we have to wage war against the cell phone and social media. Makes me think that the war has been lost a long time ago.
Yeah. I think you are on target, Darryl. Again, once again, I think you're on target. Yeah. But but anyway, the essence of the great talk of our conference was that yes, we're losing the war, but that we should fight back and try to get people to uh, deal with proper information. You know, the one thing about this new administration is that they have emphasized uh, making the truth the lie and the lie the truth. And so, truth is stands alone, and we have got to address it. Dr. Perez.
And we have to be a trusted source of information. Just
Dr. Perez.
Oh, we have to be a
Okay,
trusted
I guess so.
source of
Yeah.
valuable.
Dr. Perez.
Can you hear me?
Yes, we can hear you now.
A trusted source of the information. So as you scroll, information that is shared here is available. I know there are ways to get clips of it or whatever, but we have to become the repository of valuable, important information, and spread that information.
Any other comment? Oh, guess we're getting so involved here, forgetting that it's 10:30. Okay, I guess we'll close with this last article that waging war against the social media and misinformations. Uh, uh, so this will be our last article. Okay. Well, thank you very much for being with us today, and thank you for sharing all of the comments that you've made. It's kind of getting to the point where we recognizing that we get all this information now. With Kennedy, it may well be that we won't even get this information. And so, how do you wage war against misinformation when you have no information at all? And so, I think Darryl made many comments about what has been successful from time immemorial and waging protestations. And that may be something that we have to do much more of. But anyway, it's been a very great session in which we've shared, and look forward to seeing some more next week.
Okay, Dr. Callender,
Yes.
had something on my mind, and I was just wondering how people feel. Yesterday, I was talking to a friend of mine about, what's happening about the troops in DC and everything. And I've been upset, but maybe not necessarily. I'm thinking about the homeless. And her particular viewpoint is just like something I heard of long ago. These people that are homeless, some of them want to be on the street because they don't want to go into the shelters. And the poor, I've always heard is like the victim. The poor, they're dirty and everything. I said, well, it takes money to buy soap. And well, they need to cook for themselves. I said they got to have a stove and money to buy the food. Why are you blaming them? And I said they're going to be put in jail. And she didn't say, well, that's what they get, because I've tried to help them and say put them in homes or something, and they didn't want to go. They rather stay out on the street. So, and I was just wondering, is that the general trend of what people aren't people alarmed? I'm thinking about even the days of slavery, how people opened up their homes for the Underground Railroad, or even asking the churches to take in homeless people. Um, I don't understand. Maybe I'm the only one that's alarmed because Trump wants to round up all these homeless people and export them, put them in jails because they can't pay a fine. Well, duh, they don't have money to pay the fine. Is that a way of just incarcerating all the poor and we just stand by idly looking on? And what is that just something that I'm concerned about and general public's not?
Well, I think it's something that we all need to be concerned about. It's all part of this new administration's way of dealing with issues. And so one of the things you do with the homeless is you get them off the streets and you pretend that we have adequately taken care of them, when in point of fact we haven't. So it's all part of the Republican goals. And this is just uh, the beginning of what's going to be uh, a dictatorial situation. And yes, if we stand around and don't make any comments, it's going to get worse. But yeah, I think your appreciation of what's happening is right on target.
Yeah, it's cruelty by an extreme means, and there's a thing that says, "There, but for the grace of God, go I." All of us are two paychecks away from being homeless. But it's a matter of making the DC streets beautiful, because homeless are considered ugly and eyesores. So get them off the streets. And when you say make it safe and beautiful, the safe part is they only want to see white people, not black and brown.
Yeah, yeah. John Buchanan.
Yeah, I have a cousin, second cousin, who beautiful lady, um, who was homeless. I remember driving up South Capitol Street and stopping at